Hi, everybody. Thank you so much for joining us. I suspect we'll have a few more people trickling in, but we can go ahead and get started. I'm Fiona Danaher. I'm the director of the MGH Center for Immigrant Health. Welcome to day 2 of the Migration is Beautiful campaign. We are absolutely thrilled to have the Pre-Health Dreamers here with us again this year. Their presentation was one of the highlights of Migration is Beautiful last year. We have Dr. Lucy Agbu-Nwodo, and I hope I pronounced your name correctly, who is a chief resident for the MGH McLean Psychiatry Residency and also chair of the MGH Center for Diversity and Inclusion's Resident and Fellow Committee. We have Yari Ortiz, who is the executive director of Pre-Health Dreamers, and Angeles Almaraz, who is the network and training manager for Pre-Health Dreamers. And then Alejandra Silva Hernandez, and I apologize, Alejandra, I didn't catch your full title. But I'll hand it over to you guys, and thank you again for coming.
Oh yeah, so Alejandra is our new network and training assistant. And so, yeah, but hi, everybody. My name is Yari Ortiz or Yari Ortiz. You can call me either or. Some folks can't pronounce my name either, Yadira, but you can feel free to call me Yari. But I am the executive director of Pre-Health Dreamers, been with the team for 2.5 years, and it's been an amazing journey. I come from the higher education system. I was there as staff and advisor and establishing undocumented student-friendly resources and support, working with the technical side when it comes to coding and all of that. And so I'm really happy to now come into the nonprofit sector and really work with higher ed from a different angle, and also now work with hospitals and clinics to help also recreate these same types of support and systems for undocumented and immigrant patients and for their doctors and health staff that's supporting them on a daily basis. So I'm really thankful to be here today. And thank all of you for joining us on this training today. During this presentation, I really hope that everyone thinks outside the box. And Alejandra, feel free to start sharing while I introduce us. And during this presentation, I really hope that everyone thinks outside the box and is open to new ideas. We also want to remind you of kind of how we work in Pre-Health Dreamers, and I hope you carry this a little bit with you throughout the day. And we just believe that proper self-care is a revolutionary act for immigrants. And for all of you guys here today, you are vital. You're vital to that mission. You're vital to that belief, and carrying it through on a daily basis. That again, proper self-care is a revolutionary act for immigrants. As they're trying to pursue their healthy lifestyle, you're very vital to that journey. And if you're new to today's topic, I want to invite all of you to continue to research and learn and connect with groups that work with this population, including us. This presentation is only 1 hour of probably like 4 or 5 hour long presentation. We usually take bits and pieces for 1 hour presentations, but we are able to do a longer version for folks. So just remember, this is just a little piece of our longer presentation, and our presentation for 4 or 5 hours doesn't even cover it all. So there's even so much more info out there. So again, just see this as a glimpse of everything that is out there and just your first stepping stone if you're new to this topic. Our door is always open, so if you want to contact us. All of our speakers were already introduced today. Dr. Lucy, sorry, Dr. Agbu, don't want to mispronounce your name. Dr. Lucy, and then has been a great contributor to this entire training. She has been there with us since the beginning of the inception of this training. And we've also had other partners in the healthcare system that have helped here in California and across the country. So we really took the time to pick individuals' brains, see what is the best information to put on here, things that are really needed for health professionals at the moment, especially with everything that's been going on with COVID. We thought it was really important to pick their brains and see what really was necessary for them to really support the undocumented community. Next slide, please. Just a little bit about Pre-Health Dreamers. We have 3 areas of focus. We have our peer engagement and enrichment program called PEEP, where we guide, advise, and empower undocumented students pursuing health and science professions. This last year, we hosted 60 students in our 8-month-long program, all of which are pursuing health-related professional or graduate programs. And we're going to be starting another cohort this January and hopefully another one at the end of next year. We also create and bring resources to professionals in the health and educational systems. We advocate for more progressive health and educational policies for undocumented students. For example, in the last year and a half, we've changed around 6 schools that were previously denying undocumented students to their nursing programs and other fields. And so we were able to kind of have those open, candid conversations and advocate a little bit at those campuses. And we were able to change those policies. And currently we're working with more schools. So we're really hoping to bring a lot of awareness to administrators and decision makers at these campuses. Currently, we're looking for mentors for our program, and we'll soon start searching for speakers for our annual online national conference taking place in June. The title is Revolutionizing the Health of Undocumented Communities. Next slide, please. For today's training, our mission is to bring awareness about the undocumented community at the national level as well in the state of Massachusetts. We will touch on legislative policies that affect healthcare access to undocumented individuals, and we're going to provide you with concrete ways that you and your professional teams can support, empower, and provide a safe space for your undocumented patients. And even more importantly to us, I hope that we continue to create partnerships with you if you're here with us today. Again, please feel free to reach out to us if you want further training or want to collaborate on specific projects that you're doing. Next slide, please.
Thank you so much, Yari, for getting us started. My name is Angeles Almaraz. I'm the Network and Training Manager with Pre-Health Dreamers. Thank you all for being here. I will go ahead and get us started with some terminology, but also really just highlighting who are those individuals without permanent status in the US. Throughout today's presentation, we will be referring to this community and this population as undocumented. Truly, the term highlights those folks that do not have lawful status granted by federal authorities, or who do not possess visas or work authorizations. Folks can become undocumented through various different ways, such as overstaying a temporary visa, losing status, or entering the US without inspection. Other folks that are really the focus of today's conversation are refugees. So someone who has been forced to flee his or her country due to persecution, war, or violence. Typically, the undocumented community and the refugee community tend to face some of those similar barriers when accessing healthcare or when navigating the healthcare system in the US. As I mentioned, for the purpose of today's presentation, we're going to refer to all 3, well, 2 here. We'll talk about 2 programs just shortly that highlight some of the protections undocumented communities face or have, but we'll be referring to all 3 as undocumented. There is a big distinction between Daca and TPS, which I will cover very briefly. But we do so for the sense that Daca and TPS are not promised. These policies have had a lot of changes since they've begun. And so really a lot of those changes lead to that uncertainty when having access to healthcare or resources or just their stay in the US. Next slide, please. So with DACA, and this program is very common, I hope that both of the 2 programs we have on the screen are familiar to you all. With DACA, it was announced in 2012 It has afforded many young adults with new opportunities by providing access to a work authorization, a social security number, and protection from deportation. Folks under this protection are sometimes referred to as dreamers. However, there are a ton of different terminology or terms that folks use to identify. Documented is a very popular one as well. With TPS, this is a temporary program. Really want to focus on the temporary aspect that allows foreign nationals to remain in the US. Very similar to DACA, it provides work authorization and protection from deportation. However, TPS, just like DACA, are in constant threat of having their status rescinded. The years under which they are protected vary by program. But as we've all heard throughout the last years, TPS has been canceled for individuals from specific countries, such as Guinea and Sierra Leone. And we also saw how El Salvador, Honduras, Haiti, and Syria also had cancellation dates for 2021. However, those have been extended to December 2022. So you can only imagine what it's like to live with that status of there is an end date to my protection. So as we dive into today's information, just keeping some of this policy in mind to help inform, how we strategize protecting the community or creating resources or safe spaces for the community. Next slide, please. Very briefly, as we look at the overview of undocumented individuals or immigrants in the US, we have about 10.5 million undocumented immigrants currently in the US. I just talked about DACA and TPS, and although many of the conversations around the undocumented community center these two programs, it's important to recognize that only about 10% of the undocumented immigrants in the US are protected under these programs. So when we are, again, thinking about those resources or thinking about the population, most folks will not have protection, will not be under DACA or TPS. Next slide, please. All right, and then just diving a little bit deeper into what the undocumented community looks like in Massachusetts. I am providing the data that you see on the screen is coming from the Immigrant Learning Center. And they have estimated about 1 million immigrants in Massachusetts. If we recall that next slide, the last slide, we have 10.5 in the US. So we have a good majority in Massachusetts. About 1 in 7 are foreign born. So our pie chart on the left shows US born immigrants and foreign, or US born versus foreign born, which would be our immigrants. And we have about 1 in 7 that are in Massachusetts. When we compare this data to data from the Pew Research Center, we learned that in 2019, there was 250,000 undocumented immigrants. So I do want to highlight that with a foreign born, it does not necessarily mean they are undocumented. They could have adjusted their status or have some other lawful status in the US. So of those 1 million we see in Massachusetts, 1/4 of them are undocumented. To the right, we just see the distribution of the countries from which these immigrants are from. And this is really important to be cognizant of what are some of the barriers, the challenges, or the traumas that our patients had to endure or that are currently living through. I will take us out of our presentation slide just for 1 second, and we'll be going to this website, which really gives us an opportunity to learn about the specific needs of the Massachusetts community. So the 2 pie charts I have on the deck, we just saw. What I really enjoyed about this website, it allows you to do some of that research by county. So if you are currently living in Massachusetts, if you
package that I got, Melissa, that you left on the desk for me
if
when I
you
got
are
Brussels.
looking to create some resources or just become more informed, this map really allows you to break it down by country and by county in Massachusetts. So if we were to select Haiti or Brazil, it's very tiny for me. The map will change colors and kind of show you where the concentration of immigrants living in these counties are. So again, this really, I hope this research just informs some of your efforts or allows you to have a bit more information about who are the folks that are really in that county and what are those resources, what are those barriers that they are facing. Thank you so much, Ale. We can go ahead and head on back. And there we go. Last but not least, I do have a few more numbers, and I hope not to bore anyone because I know just looking at numbers can be a little difficult. With this, I want, as we continue to learn today about creating safe spaces or building resources for the undocumented community, being very well informed with who our community is really allows us to have the greatest impact. And so we all know that health insurance coverage can be one of the greatest barriers for folks to receive medical or health care. And so within the state of Massachusetts, and this information is provided by the Center for Migration Studies, we see that there is 31% of undocumented and eligible to naturalize population, meaning this may be folks that have legal permanent residency. So it's not specific to just the undocumented community, however, does provide information about the immigrant community. Even those that have lawful status, we see that 32% or 31% do not have health insurance coverage, which just allows you to gauge how many folks may not even have access to a doctor's office. And so diving deeper into what the community needs, we go into the next slide, please. Just taking a peek at what our age range is for the immigrant community. And we actually see that ages 5 through 17 and our young adults are our largest group, followed by 35 to 44. And so really this informs, what kind of programming or who is your target audience when trying to, or age audience, when building some of these resources. Next slide. We live in the era of the internet. We are all online today. And, in that last year, we all really kind of dove into everything being online. And so taking that into account, we look at the data for folks that have access to a computer or the internet. And as you see it on the screen, a large majority, we see a 92% of having access to both. However, when we strategize outreach, having access doesn't always mean there's literacy. And so we have to also take that into account and get creative with how are we going to utilize this access to the internet in a way that really expands the reach that we want it to reach. And then last but not least, as we go into this very last set of data, we are just looking at our gender. On screen, we just see male and female, accounting for 56% of male immigrants in Massachusetts. And so again, this really just serves to inform a little bit of what Yari and Lucy will be talking about today when it comes more to centering the conversation, building the resources, and becoming informed about the immigrant community.
Thank you, Angeles. And just to set a little bit of more context, I just want to go really quick through national legislation to kind of put things into perspective. And I really also want to put this information on everybody's radar as a way to bring awareness of how much legislation changes. It can even change within a year. And it's been changing back and forth, as you'll see in our next 3 slides. And this really causes a lot of anxiety and fear and disconnect for patients who are immigrants who are undocumented. So I just really want you to think about that as we talk a little bit about the immigration and the legislation that has happened. And so the last immigration reform was the Immigration Reform and Control Act of 1986. And this was the first legislative attempt to comprehensively address the issue of immigration. The bill did include sanctions against employers for the hiring of undocumented migrants, more robust border enforcement, and an expansive legalization program that was unprecedented. This legislation still has effects on immigrants today. In the last 20 years, the Federal DREAM Act, which is what would provide a path to residency or citizenship to undocumented youth, it has failed to pass several times. It failed to pass in 2001, 2010, 2017, and 2019. And so other immigration reform bills have also failed to pass at the federal level. However, we were able to advocate and pass for something like Daca, which is what Angeles was talking about earlier, for undocumented youth to get work permits, which has extended the opportunities for them to also get licensing in some states, and so on, their professional licensing. However, we also want to remember, like, a change in political parties does not promise an easier immigration path. Many community members remain undocumented without immigration reform, and increasingly restrictive policies under both parties or both presidencies, both Democratic and Republican. And certain immigration status, such as TPS and DACAs, we just want to reiterate that they're continuously in danger. Right now, for TPS, they were extended for now since May 22nd. However, we haven't heard any more updates. So we're hoping that we do get more updates for our TPS students, for our TPS community, so that they really can continue to hold on to their jobs, hold on to their educational goals that they have here, and just keep working, and providing for their families. Next slide, please. Also, access to healthcare and other federal programs from their inception have left out undocumented immigrants. This includes the Supplemental Nutrition Assistance Program known as SNAP. Medicaid also has left out. The federal Medicaid has also left out, and I say federal because we have Medi-Cal here in California. Federal Medicaid has been left out, has left out undocumented individuals, cash assistance programs at the federal level. And also in 1996, federal welfare and immigration laws introduced also new restrictions, which keeps lawfully residing immigrants from receiving assistance under federal benefit programs for at least 5 years. So even folks, once they get their permanent residency, it still takes time, one, to sometimes gain access to programs in healthcare, but also it's also very difficult to continue to learn and navigate the healthcare system once you kind of graduate into that level of being able to obtain some health access. It does become difficult to kind of navigate it. I mean, I've been here and I've always had health insurance here in the US, and I've always had my stable healthcare facility that I go to. And it's still really difficult sometimes to navigate it and learn about our doctors and which doctors is the best fit for me. I always keep that in mind for our immigrant community members that have just arrived. And, one, the system is different. Two, do I trust it because of all the changes that have happened? And three, how do I get that comfort level with my doctor once I do have one? So I always just try to keep those things in mind. Next slide. So even when immigrants are eligible for benefits, that chilling effect happens, and it continues to happen, which creates fear and confusion about the laws. So you're always wondering why folks don't come back to your office as a doctor, or I always say this when I'm presenting to teachers: if you're a teacher and you're just wondering why my children or why my students, why haven't their parents taken them to the doctor? This could be reasons why the parents don't trust. They may be immigrants, they may be new to the country, they may be undocumented. So there are fears associated. Even when your children are born in the US, there are still fears about taking them to the doctor's office. So I always tell my teachers or the teachers that I present to just to keep that in mind when they're working with the communities that they do, especially where I live. We have a high percentage of immigrant and undocumented individuals. Next slide. And then here are just some examples. We want to bring it back to Massachusetts. Here in California, we have Medi-Cal, and here already undocumented youth under the age of 26 as of 2020 are able to apply for it regardless of their immigration status. And this year we just passed Medi-Cal for elders, which is 55 and over. So starting next May, I believe, 2022, our elders who are undocumented will also be able to benefit from Medi-Cal. However, there's work that needs to be done on our end as far as bringing that awareness and kind of, bridging them with the Medi-Cal offices, with making the process familiar with them, setting kind of like demystifying some of the things that they feel like, if I do get Medi-Cal, I won't be able to apply for a status later on, which is truly incorrect because Medi-Cal is a state program. In Massachusetts, there's also programs there that you may be familiar with more than I am because I am not in Massachusetts. But just in case you're not, we wanted to put some of these resources on here. At the end, you will get the link for like a goodie bag that you'll take with you, a toolkit with flyers, resources for your office, and some of these links will be provided for you. Next slide.
Thank you. I think this is where I come in. Thank you guys so much for getting us started. And I really, want to just start by saying that, for me personally, ever since I embarked on a career in medicine and in healthcare, one thing that I've always dealt with was this sense of helplessness, right? When you hear about the issues that are affecting the patients that you care for, when you hear about their plight, you have this sense of like, what can I do to help? How do we attack and address all the ways in which their lives are negatively affected by factors that we don't always know what to fix? And so that's where structural competency comes into play. And I really want to frame this for us today as a framework that has really gained a lot of traction in recent years, really trying to encourage healthcare professionals, those who are interfacing with patients, to become equipped in recognizing and analyzing and intervening upon the various structural factors that impact healthcare disparities for all of our patients, including our immigrant patients. These structural factors can include policies clearly outlined by my colleagues, starting us off. It can include economic systems, and other institutional, factors such as ideas and cultural norms in which we exist in that maintain these modern social inequities and differential access to opportunities, be it access to healthcare, be it access to educational opportunities, vocational and economic barriers, and ways in which we access things like food, housing, all these factors. So we look at structural competency as giving us the toolkit to be able to act upon these factors, to feel like perhaps a little bit less helpless in being able to address the factors that we encounter when we're dealing with patients who come to us with various, sometimes seemingly insurmountable obstacles facing them. We can and are able to do something. Next slide, please. And each time we are engaging in, whether it's around the healthcare system, whether around in various factors involving those who come from different backgrounds, it's important that we always frame this around cultural humility. Many of you may have heard this term coined back in '98 by Dr. Jean-Marie Garcia and Melanie Tevelon, and they really, really framed this for us as a guideline for us to think about as we are really, especially in recent years, right, as we in the healthcare system around this country are reckoning with our very entrenched history of racism in this country, structural racism, how do we go about with the framework of humility in engaging with those who come from different backgrounds from us? And cultural humility is a way that we can think about doing that. And first and foremost, each of us can take a personal commitment to self-evaluation, self-reflection, and self-critique. That is a really challenging thing to do sometimes, to face the ways in which we can embark on a lifelong of learning, knowing that we can never get it right, but committing to embarking on that process. And recognizing that there is going to be power differential and imbalances when we engage in those who society has not endowed with power and has given us power. And so when we are in these spaces, knowing that there are going to be these power shuffles, and how do we share power with others? And how do we recognize that it's happening so that we're able to act accordingly? And knowing to know that it's going to be sensitive, right? It's going to be sometimes interpersonally fraught. Learning from those differences and coming from a place of humility helps us all. And all of us highlighting and enacting and asking for and fighting for institutional accountability. So we're all here, right, on a week-long Migration is Beautiful campaign. This is part of that. We're already doing that. So being able to account and ask for that is going to be really important. And there is this growing movement in thinking about cultural humility as being synergistic with both cultural competence and structural competence. So embedding all of this across what we do always, approaching it with a place of humility, which is, again, really hard to do sometimes, but keeping that in the forefront of what we do when we are engaging with immigrants coming to us from a place of vulnerability. Can we ourselves be vulnerable in those encounters? Next slide, please. So when we think about structural competency, how do we intervene? I love that there are different levels that we can actually act upon to make a difference. And sometimes we're only able to work at certain levels based on where we are developmentally in our career, based on where we are in our abilities of resources. Sometimes we can do multiple, sometimes they're interface, sometimes it's the same across different levels. So for example, you're already here on this talk. On an individual level, you're educating yourself about these structures. You're here to learn. You're going to all the different talks this week to educate yourself about all the ways in which issues are affecting immigrants in the healthcare system. You're trying to figure out how to address your own implicit bias that we all have. All these ways are ways that individuals can address from a place of structural competency to help improve the healthcare of patients coming from immigrant backgrounds. Interpersonal level, right? Being able to share power when you're in those spaces with the patients, being able to understand and address what they're coming into you with. In those moments, how do we make those encounters feel safe for the patient in front of us? On a clinical level, an institutional level, how do we make the layout of our clinic to be welcoming? I see some of you with your background, with your symbol, showing that you are supporting of immigrants. I see the badges, sometimes that we're all wearing around campuses. I see people using terminology to show that we are supportive. How do we take into effect to create the structural physical layouts? How do we make our environment in our hospital system show that we are supportive? This campaign is another way of doing that. What other ways can we as a clinic, can we as an office, can we as an institution do to create spaces that are safe for our patients? And as a community, we have a broad, Massachusetts, resources, right? How do we work with community-based programming to help our, patients? Do we go where the patients live, right? Do we approach them from a place of humility to understand what their needs are? Are we investing in resources into those places? How do we support our communities, not from our view of what we think they need, but what do they actually need? Research, right? We are doing research at all different levels at Mass General and Brigham and all the big systems that support healthcare in Boston. Are we being culturally sensitive? Are we being, using anti-racist lens in how we do research? Are we incorporating power dynamics and recognizing those places in our research? Are we doing community-based research? Are we looking at policies that impact health? So how can our research be better equipped to be able to be better supportive of our immigrant patients? What questions are we asking? Who's asking those questions? Who's doing those studies? Who's being studied? All these places that we can look at in our research to be more, supportive of our immigrant patients. And then in policy, my colleagues have outlined the impact, right? Sometimes devastating, sometimes can be life-changing, and sometimes can keep you in a sense of suspended animation about your life, right? Policy matters, policy. So there are different levels that we can intervene from a structural competency to help us. So really think about all these ways when we think about how we can support our patients. Next slide, please. And so I'm a psychiatrist, like was introduced by Dr. Fahar at the beginning. So part of my work involves mental health. We are in a pandemic. We've all, whether we're immigrants or not, we've all been facing the ways in which mental health has been sort of like brought up to our consciousness. Imagine how our undocumented immigrants are facing mental health in a society that has not always been welcoming for them, right? We know that the migration process itself, arriving in a host country, can impact your mental health in various negative ways. Just imagining what someone goes through to get to this country in itself, that trauma alone is devastating. People experience violence in their home country, in their transit to come to this country, whether it's physical violence, psychological violence, sexual violence, domestic violence, all the ways in which trauma can impact someone they have gone through to come here, leaving their families, family separation, right? As a resident, right, I think of how I am away from my family in California for 4 years, and I'm like, wow, I'm separated from my loved ones. Imagine being forcibly separated from those that you care about, not knowing that you can go back, leaving your child or putting your child in danger. All the ways in which we as people can't even imagine what that feels like. People are wrangling with this all the time. Think of the mental health impact of that. And then you come here and you don't have social support. Who is there to support you? Where are your people? Where is your community? Where are the safe spaces? This can sometimes lead to maladaptive behavior. People can sometimes turn to substance use, turn to situations that put them, in place for even more violence, domestic violence, and can lead to more adverse outcomes. And then imagine a community, a world, a system, a country that tells you that you don't belong, and you are constantly trying to hide your status. You don't know who to trust. You are in constant state of hypervigilance, changing your environment, don't know where you belong. That can really cause a loss of identity, a loss of who you are, loss of self-worth. It erodes the spirit. If we don't understand all the ways in which people are being affected, we're not going to be able to address the mental health risk factors affecting our patients. So it's really important to try to frame all of this for all of us, to know the ways, devastating ways in which people exist, sometimes in silence, sometimes in hidden full view of us and not always being appreciated. So I really want to paint this for all of us who may know some of these things, but the visceral risk factors that we're facing on a mental health side of things. Next slide, please. And so what are the barriers that people face in mental health treatment, right? Some may say we all face barriers to mental health treatment in a pandemic, right? We have seen our emergency rooms grow in volumes, our hospital systems are growing in volume, and there is lack of access for a lot of people. And yet again, for some, it's even worse. Immigrants are less likely than US-born individuals to access mental health services. And there are many, many factors that contribute to this, right? Try to navigate a system where people don't speak your language. Try to share with someone your most deepest, most scariest, most vulnerable thoughts in a different language where they don't understand you. People are asking for you to be vulnerable and share what you're struggling with, and there's no way for you to have linguistic access to that. That is a formidable obstacle. We don't have information and resources where people need to know what's actually available, right? And then there's stigma around mental illness. And I say that this stigma is actually not what we think of it as. People say, oh, people of color don't want to see mental health providers because they don't believe in it. That's not always true. right? When people interface with the mental health system and they don't feel supported, right? Why would they want to come back? So the stigma is not always from those who don't want to access mental health. It's because they have had negative experiences that lead them not to want to come back. So we have to ask ourselves, are we perpetuating those feelings of stigma that people have? So it's really important that we as healthcare providers, we as healthcare systems look inwards to wonder, what is it about us that makes certain people less likely to want to engage in our services? And not just say, oh, they just have stigma for mental health, that's why they don't want to have access. And we don't have adequate, culturally sensitive and appropriate care for people. So why would they want to come back? And people may have preference for their own spiritual, culturally more congruent treatment options that we don't even want to hear about. There's a certain Western Eurocentric view in our medical system that doesn't even leave room to want to hear what others have to say. Hence that place of cultural humility, right? Medical distrust, medical mistrust. Across multiple communities, we know that structural racism in this country has created a fragmentation in how people engage in medical treatment in this country, especially when it comes to medical care and psychiatry. We have to do better. And time again, we've had an administration over the last 4 years that really increasingly ramped up exclusionary immigration policies that led to a lot of stress and apprehension. People were afraid to take their kids to school, to go to church, to go to grocery store, living in constant fear. That made it hard to want to go to the hospital to show that you're struggling. We had patients who were afraid to show up when they were in need of acute mental health because they were afraid of actually being, apprehended in the hospital. That is untenable. And then costs, right? We showed about the insurance access. Those things are there. And I appreciate that we have something, but we don't have nearly enough. Who do we value in our society? Who matters to us, right? Who gets resources? Whose lives matter, right? So we have to ask ourselves these questions because access to care, where we invest our resources, says a lot. And people aren't accessing things because they can't afford it. If you can't afford food and housing, how are you going to be able to afford getting a therapist when you are going through PTSD? So we have to really figure out how do we increase access to everyone, not just those who have documentation, not just those who we believe should qualify for insurance. Everyone should be able to access care. And it's important that we do better in our healthcare systems, that we hold people accountable, our systems accountable to do more for those who are most vulnerable, for those who are most disenfranchised in our healthcare system. Next slide, please. And so we ask ourselves, right, how do we support our patients, right? You are here, and I'm so grateful that you are here to hear these discussions, that you're going to be here throughout the whole week. We have to be open to hearing and supporting what they want to do, what is important to them, what other non-medical sources do they feel is congruent to their spiritual, their religious, their familiar support system. Hear them out before we judge that it's not good enough. Encouraging patients to foster connectedness with their own cultural communities, because we know that people who are engaged in these sort of supportive networks have better health outcomes, right? Incorporate family outreach when appropriate in shared decision making, because we know that many patients that come from immigrant backgrounds really are part of a more community-centered, more family-oriented settings, and they thrive with that. And we should make every effort to understand what are family dynamics like, who are important to you, so we can incorporate them in the care that we give to our patients, right? And trying to come from a place of humility and compassion about the unique challenges that immigrants face. We don't always understand that not everything for every patient is going to, be the same. If people miss appointments, it's not because they're non-adherent to care or non-compliant, as they sometimes use to care. They're not trying to not cooperate. It's because there are factors sometimes beyond their control that make it so. How can we be more compassionate in these challenges? How do we create accommodations to support our patients? And as I mentioned already, stronger social identity equals greater resilience, right? And it's important that as we discuss risk factors, we also discuss protective factors. Immigrants have a lot of protective factors. The fact that people survive and thrive in societies that are not created for them shows a remarkable amount of creativity, about resilience, about grit, that we also have to highlight, that we also have to reframe their journeys, not of just of struggle, of trauma, of woe is you, but let's figure out how to uplift these communities. Let's figure out how to change the narrative around who they are and know that they bring so much beauty. They bring so much to our community. Hence why this whole week is so powerful and so beautiful. And let's make sure we're doing everything that we can to make all people feel welcome and included, and in creating pathways to incorporate them into the main dominant societies. They're not just in outlier groups. Thank you so much for being here. I really appreciate the opportunity.
Thank you so much, just for all of that. Just thank you so much. Ale, please go to the next slide. The next one. Wonderful. Sorry, I skipped the other slide because I think Lucy just said more than enough with that, even that slide. You even covered my part, girl. And so we're going to go ahead and just talk a little bit more now about really putting all of this into place. Everything that Lucy just kind of just, you know, she spit fire right now, and everything that all the fire that she gave you. Now let's create something with it, right? So now let's start creating those welcoming spaces for the undocumented, for the immigrant communities. And really, it's going to take a lot of folks. Like Lucy was saying, we can do individual work, but I also believe that like teamwork and unionizing everybody to be on a similar page or stronger, those that are leaders, bring them in so that you can really create these welcoming spaces. The decision makers at your clinics, at your hospitals, wherever it is that you're working, are very important in these in the roles to really inspire the entire team to move forward, right? The decisions are really important. They can even make us or break us, right? So let's incorporate everybody, from the folks that are admitting the patient, the folks that are admitting or making the appointments, to the hospital administration, to the doctors, to the nurses. Everybody really needs to be on the same page for this. And so one of the greatest things that you can do, and it's such a simple thing, but for some, it does take kind of that initiative and that courage to do so, is putting just flyers and content up on your walls that creates that welcoming space for individuals. So we at Pre-Health Dreamers have created that healthcare is a human right logo that you see on the slide, and you'll get a copy of that. You're gonna get a version where you can even put your own logo on there. So we've made it so that you can transfer the content or change it up so that it fits wherever it is that you're working, right? So put those up. The flower, the hummingbirds and butterflies are just a symbol of migration. Migrants know it, immigrants know it, youth know it as a representation of this community. Putting that out there everywhere in your hospitals, in your clinics, is going to be that welcome sign for individuals. Also, don't be afraid to wear those pins, and we're going to show that to you in a little bit of some of the examples of what that looks like. But also have those tough conversations. And trust me, I worked in higher ed for a long time. They were tough conversations there. So I know they're going to be tough conversations everywhere on how do we deal if ICE does show up to our institution or to our hospital or our clinic? How are we going to create that plan? Who's going to be in the front line? Who's going to be able to talk to the agents when they're coming in? Or please understand that even having police at your clinic or at your hospital can sometimes be very kind of an anxiety trigger for those patients who are undocumented or immigrant, because of either experiences they've had in this country or experiences they've even had their own country, right? Not trusting and really being afraid. I'm afraid to even take my daughter to when they have a fever, because right in the beginning, before I go into the hospital, there's already police there. So really taking that initiative and having those conversations of how can we make it a more friendly setting for individuals, even before they're stepping in. And so if we can please go on to the next slide. So you are going to be getting copies of some of the files that you see in here, the healthcare providers and immigration enforcement know your rights, know your patient's right. You're going to get a copy of this. So feel free to print it out, put it in your office. If you're going to be hosting a clinic out in the community, take these with you. When patients see this, they'll know, hey, this professional, they probably know, and they're going to be somebody that I can maybe talk to, and just let them know and start that conversation, or that I can feel safe to come to and let them know what's going on. Just little symbols like that. You'll see on one of the photos at the bottom also a pin. This is one of our colleagues, Dr. Denise Rojas, that she wears this, and she always has patients asking her, like, oh, I love your pin. What does it mean? Sometimes folks already know what they mean, but they want to ensure that she's a safe space for them. And some folks are like, oh yeah, let me tell you, I came from this certain country and I went through this. And that opens up that conversation to really ask, hey, what's going on at home? How can we help you? What kind of resources can we provide? And you can help, it can help assess really your patient in a much deeper way. Also, your websites. Angeles threw us some data earlier on of individuals that know really that have access to the internet. Again, the capacity of how much they know, we don't know at the moment, but at least make some language available on your websites. Recently, I was helping a mom who a friend of hers wasn't she believed that she had gotten some type of surgery done without any anesthesia or even local anesthetic. She was really trying to advocate. They were really, really nervous about it. And even I went on to the hospitals to see, do they have a diversity inclusion? Who can we talk to? Like, we need interpreters there. And really, they didn't have anything, which told me they really don't understand how to work with the community. And they really do have a low population of immigrant. But it was really interesting so that we can start having those conversations. Just on their website, I already knew that there might be some disconnect there between them and the immigrant community. So just putting a statement out on your website can be a huge window, for individuals to be able to come into your space, into your hospital or into your clinic. Next slide, please. Well, we have wonderful partners here in California. We partner with a clinic called Clínica Martín Baro. And so they do a really amazing job at really welcoming the community, regardless of their background, regardless of their immigration status. And I know that you can't always make a hospital look entirely like this, but in higher education, we have created, especially in California, every UC system or every 4-year California system university, they have either an undocumented student program or a dream center, which is an office, a space where students who are undocumented can go in. So even though, creating this kind of staging or this kind of support all across the hospital may not be something that's possible, but creating an office where immigrants can go in and say, hey, this is somewhere where I can kind of start talking to folks and create that connection between me and the doctor at this hospital. Right, so even creating this space, they've done an amazing job at really putting pictures up on their walls. If you go on to the next slide, they've really done an amazing job at putting up photos that are friendly, that open up those conversations, that make people feel safe to even ask a question about, health access. Where can I go for COVID test? Or is it safe for me to get a COVID test? Not as far as the vaccine itself, but if I get a COVID test, will later on I be able to apply for residency? That's how these conversations sometimes work. A COVID shot, sometimes it's not even the fear of getting the shot itself, but is it going to affect me because I'm using a service, right? So somebody that they can have this conversation with in a safe setting A lot of hospitals are now putting up departments or offices for inclusion geared or equity and inclusion geared. These can be great places that set off these initiatives to put an office aside or a space aside or do a community kind of event where folks can get this kind of community feeling for them and feeling welcome when they're coming in. So, I mean, there's so many different ways of doing it. And I know sometimes it's difficult because space is limited probably at some places where you work, but it just takes a little bit of collaboration and team efforts across the entire hospital to kind of make this happen. And I hopefully you'll find folks that are able to do that with you. Next slide, please. And so we want to provide a little bit more concrete ways on how to serve the undocumented and immigrant community. I would always say just establish partnerships with the nonprofits. I think this is really important. A lot of the grassroots organizations, they know your community, or they know the undocumented community, they know the immigrant community. So for you, like sometimes organizations or hospitals are trying to assess who are the folks that, who are the immigrants in our community, what are their needs. Let me tell you, there's more than likely already organizations in your community that have done that. Partner with them, save some time, ask them, hey, what are you guys doing? How can we collaborate? How can we support? And a lot of times those grassroots organizations have already gained the, that, what is the word I'm looking for? They already have the respect of the community. You know, and so you really can just create those partnerships and be allowed in and learn from those that have already been doing the work, and allow them to be that bridge between the patients and the community and you. Also, another way that you can collaborate is have them come into your space, have them come into your hospital, have them come in and volunteer. Also, you know, talk to them about, you know, interpreters. Hire folks from the community to be interpreters, or work with organizations that are working with immigrant communities. If they have interpreters that can be brought in and that are licensed to do so, that is probably a really great way to do it. Always ask if your interpreters are well informed with this information. And sometimes also in hiring individuals, I've seen it happen again and again. We're going to hire a coordinator to work with the immigrant community because they know a specific language that we need. They know Spanish. And we believe that that's the only requirement, right, to work with the community. No, there's so much other background that's really needed to support the community in a much larger way. Have them go through trainings like these to be able to support as best as possible. So it's really more than just surface level, it's going beyond that. Next slide, please. I know we're running out of time, so I'll try to go as quickly as possible. Professional development, I already said that a little bit, like liaisons with the community. We want to remind folks to please not put the weight on the shoulders of the immigrant community and undocumented community to teach us about their struggles and about their needs. That can sometimes trigger the undocumented individuals or the immigrants. Imagine having to tell a really difficult story over and over. That can really sometimes cause some triggers for individuals. Some are better than others in telling their story. Some have been able to kind of get through it a little bit better, or have healed a little bit more, but we just want to remind folks to not put that on the shoulders of folks. Again, there's more than likely individuals in your community who have already rolled up their sleeves and know individuals, so just work with them. Next slide, please. Next slide. And so everybody is going to get this toolkit. I'm going to go ahead and put the link on the chat. And it's going to provide for you the flyers that are on the slide here, along with other slides and resources that may be beneficial to you. These are nationwide and some are very Massachusetts specific. And so again, feel free to print out all of these PDF versions, put them around your office. If you have clinics, put them on there. You can always contact these organizations or us to give you kind of more thorough explanation of what these documents are talking about in the background information, and how to move forward in training your staff on learning some of this information that's here. Next slide, please. You're also going to get this slide within your toolkit. It's very specific to Massachusetts. This is just to get you started. I was researching Massachusetts in the past couple of days, and there's so many organizations in your area that have already been helping. So again, this is just search that in your Google site and just say, immigrant friendly organizations in Massachusetts, and you'll see individual sites pop up, and just get to know them, make appointments with them. What do they offer? And is that a good collaborative partnership for you and your team to be able to work a little bit better with the undocumented and immigrant community? Next slide. We want to thank all of you for joining us today. I think it's just amazing. Just showing up is great work, and that just shows that you're ready to take that next step if you haven't done so. I know some folks on here have already been doing that labor of supporting the community and establishing. So we were really happy that you showed up today, and I hope that you guys continue to connect. And I see that there's other workshops throughout the conference that kind of talk a little bit more in detail some of the specific slides that we have here with you today. So I hope that you guys get to join the other workshops as well. Thank you so much for having us today.
Thank you so much for coming. That was amazing. You guys provide such a helpful framework for all of the presentations to come. So we really, really appreciate it. For anybody who is left on the call, there is another session at 1:30 hosted by Boston Healthcare for the homeless and health law advocates, specifically addressing insurance access for this patient population. All right, thank you guys again.
All right, thank you.